Welcome to Cracking Cancer, where we tackle the tough questions about cancer with real patients and world experts. Our mission is to empower the cancer community through education, bring transparency to the oncology system, and drive funding for critical cancer research. Whether you're facing a diagnosis, supporting a loved one, or simply here to learn, we're here to bring clarity, hope, and action to the fight against cancer. Hey everyone, welcome to Cracking Cancer. I am your host, Dr. Kyle Concannon, physician scientist at MD Anderson Cancer Center, and I am here joined with Samantha Morell.
Hi everyone, Samantha Morell. Good to be here. I'm a patient advocate. I have stage 4 lung cancer with a HER2 mutation, and it's great to be here. Just a disclaimer though, I had treatment 4 days ago, so chemo brain is real, and I might be a little fuzzy, but we're gonna attack this.
Yeah, and that's the chemo brain is very real. But so far, we were chatting a little bit before the podcast. I think you're doing great.
Thanks.
But unlimited free passes. So yeah, this is great. We'll put our editors through the ringer here. So today we're going to be answering the question, am I in remission? Which is a question I get a lot as an oncologist, discussing scans. And Samantha, you've probably heard this a lot in the patient community.
Yes, I have. I've heard the word remission a lot, and I'll say that I'm very confused by it. So it's great that we're having this conversation.
Yeah, I think you're right to be confused. I get confused with the term because it's a kind of an ambiguous term. I think it does mean different things to different people. And
Absolutely.
when I'm having this discussion, a lot of times I end up really defining terms and then getting a little more granular about it. So hopefully we can do that today. And we've assembled some common questions that I've received that other patients have posted and things. And I think the first question that everyone seems to have really is like, what is this term? What does remission mean?
Mm-hmm.
And Samantha, when you hear the term, what comes to mind for you?
Immediately, it means that I have no cancer in my body that is not like you can't visibly see the cancer anymore. But also go one step further because I know too much. Remission to me would be that you can't see anything on a scan and you have nothing circulating either. That because those two things can be kind of different, right? And I think a lot of people count them being in remission when they can't see anything on a scan, but that's not necessarily accurate.
Yeah, I think that's my understanding of what people mean too. When we say we're in remission or one's in remission, I think they mean they don't see anything, but there's also this understanding of, am I in remission? And one can come out of remission. Mm-hmm. So I think, the sentiment is the scans all look negative and I have no cancer, but there's this vague understanding that it can come back, right. Which, is super confusing because
it's very confusing. And I also count remission as mainly for stage 1 to stage 3 cancer, but I see a lot of people talking about remission when they're in stage 4, which to me really throws a wrench in the works and causes a lot of confusion, I think, to people online as well when they see that people at stage 4 in remission. And like some people will think, oh, that means they're cured. So there's a lot of confusion out there.
Yeah. When you hear remission, do you associate remission with cure?
I do. Mm-hmm. And that's not necessarily accurate.
Do you think other people do? Is that how it's used?
Yes.
Yeah.
Yes, I believe so.
Yeah. So I think the ambiguity that you're bringing up is the same ambiguity I hear. And mm-hmm. I imagine the folks listening are like, I'm confused by this too, because it's kind of a vague term. And I think it's a vague term because it's used differently in different contexts. And I would say in solid tumor cancers, the lung cancers like you have, like I work with, colon cancer, prostate cancer, we don't use remission as much as we used to. There are still people that will use that term. But we tend to use, I guess, different terms because before we would have these terms like complete remission, partial remission, stable disease, and growth. And I think because of the ambiguity of what that might mean, I've deviated away from that. And instead of saying remission to mean the cancer is either gone or dormant, I'll use terms that are maybe a little more radiographic, if that makes sense.
Mm-hmm.
And so I think we've, got a reasonable sense for remission as a vague term. I think people do use it to mean cured. I
Yeah.
don't think that's an accurate understanding a
Yeah.
lot of the time. And maybe a better term that I tend to use is like what actually happened in response to treatment. Because then
I
you're not
like that.
making the leap of assumption as to what's
Mm-hmm.
going to happen next, or is it really gone, or can we just not see it? Like, let's, call a spade a spade. What's the terminology that's been used with you? You have stage 4 disease, you've been on treatment, your tumors have shrunken.
I mean, I haven't had really any type of scientific, terminology being thrown at me, but just more that you're responding and you're responding really well. Um, and then I've kind of had some stability, so I'm called stable. So those are really the only two terms that have ever recently come out of doctors' mouths to me. We don't like the word progression, and that won't happen for some time. But I've had that word thrown at me before as well, obviously, when I progressed over the Christmas break. But yeah, I've never, obviously, remission, none of those words have been thrown at me at all during the course of my treatment.
Yeah, I think that is maybe representative of how the field is changing. Or, maybe this is lung cancer specific. I don't think so. I think people are really trying to change their phrasing here. So instead, we tend to use responses that are around the radiographic change, meaning like, what did this scan show compared to other scans?
Mm-hmm.
What is the solid mass that we call a tumor? What is that actually doing in response to a therapy? And there are a few options that we can use based on the nomenclature that is in the field. And the one that I think was previously associated with complete remission, we'll call complete response.
Mm-hmm.
What we mean by that is there was a tumor visible before, and now we don't see it. So that's the basic explanation for a complete response. So in the example of a lung cancer, you might have something in the lung and it was given a therapy. Uh, and then we do a scan a couple months later and we don't see it anymore. Maybe there's a little bit of area where it might have used to have been, a little bit of scar tissue, very small. And then the radiologist says, I don't see anything here that looks like tumor. So we might say that's a complete response. And this can
Which is
happen.
very,
Oh, sorry.
no, I was going to say, which is very exciting.
Yeah. Well, you've had areas of complete response.
I have, yes,
Yeah.
in my liver. Yep.
What is your understanding when your conceptual understanding of what's going on?
I honestly never associated with it being a complete response, which is weird. I should have. To me, I saw it as, oh, it's literally not there anymore, but is it being sneaky? Is it really there? We just can't see it because the scan. But I've been told by my doctor that these CT scans are so granular now that they can really see a lot more things than they could like 10, 15 years ago. And like some of my tumors that you can see now on my scan, you probably wouldn't have been able to see on a scan 15 years ago, just because of how small they are. So while it's amazing they've gone away in some areas, I'm just like, but where are you?
Yeah.
I almost don't trust it. It's like,
Well, and
where did you go?
when you say gone away in an area, do you have a perception that there's anything there at all, or it's truly gone?
I don't know. That's the big $1 million
Yeah.
question, right? I mean, we can't visibly see
Yeah.
it on a scan, but are there still cancerous particles? I don't know if that's the right word, but cancerous things still floating around in that area that aren't maybe as put together as they were before, but they're still there.
Yeah. Yeah. I think that's my understanding too. And the reality is a lot of times we don't know. When
Yeah.
something was there and it shrinks down, we don't see any evidence of cancer. And a lot of times, if you have a complete response everywhere, that's a term we'll
Hmm.
use, is no evidence of disease. And we're careful to use that term. We don't say there's no disease. And I think that's where the
Like that.
deviation from complete remission came from.
Hmm.
It's because people, like you said, I was in complete remission, I don't have cancer. And it's like, well, no, we had to change our terminology, I think, a little bit to be a little more accurate. Because once something shrinks down all the way, then you may still have tumor cells there.
Right.
But in order for a CAT scan to see something, it has to be probably visible to the naked eye too. And
Hmm.
cells, I don't think we have an appreciation for just how small they are. By
Yeah.
the time you're seeing it on a CAT scan, there are millions there.
Yeah.
By the time it's, the lowest threshold of detection is millions to billions of cells. So they're really small.
Yeah.
And you don't need a lot to be there for them to at some point maybe grow.
Hmm.
So, now we use this term complete response. And that really is, in my view, a radiographic term. It just means what we're seeing on the scan. It's a description. I'm
Hmm.
not giving any assumption as to the underlying tumor biology, but there's no way to interpret it as anything other than a good thing. Like,
Yeah.
it is good.
Yeah.
The tumor responded really well. You had something there. I can't even see it anymore. Like, there's no way it's not a good thing.
Yeah.
But I think the assumption that a complete response or that term, complete remission means there's no cancer, we can't make that assumption. Is that different from your maybe prior understanding, Samantha, or how does your?
Oh, absolutely. No, you're helping a lot with what it means. I think we've covered this on a different podcast, but when we talked about like complete response versus partial response versus stable disease, like which one is better? Is there a better one? Especially at stage 4, like as long as you're living and managing well in terms of your life and this cancer being in your body, what is the real difference between having a complete response, no evidence of disease, versus stable disease? If the cancer can just hang out and be stable, and so I think there's a lot of confusion between those three areas of like we really should be celebrating all of them. While I understand that having no visible disease in your body is incredible and something to be celebrated, at stage 4, that doesn't mean that your scan in 3 months isn't going to show suddenly a ton of new disease. So it's almost like a fake safety blanket of thinking that everything is wonderful when it's maybe not necessarily in the future going to be that way.
Yeah, I think that's a good point. And I think that's probably why one of the reasons we've gone to the radiographic descriptor part, because people have used the term remission in all those things.
Yeah.
So people will say, oh, or historically, that your cancer isn't growing, it's in remission. But they're like, well, I still see it. And I think that's probably a lot of the ambiguity around that term.
Yeah.
So now, we mentioned the definition of a complete response is when you can't really see any of the cancer that you saw there before. Great thing. Even if they're, in likelihood for stage 4 patients, most of the time there's going to be something there that you can't see that's below the limit of detection for the scan. It's just too small. And then, but we get into these other types of responses you could have. And again, these are just descriptions of what the tumor is doing. But the next one is a partial response. And that's something that has shrunk by at least about a third. And you can still see it. It's still something there, but it's getting smaller. And that partial response can continue to get smaller over time. It can go down into that complete response. It can eventually become not visible. But that's another term that someone might have in the past used as partial remission, maybe. Um, but instead, now we use this term partial response, or at least I use the term partial response. And that's what studies would use as well.
And I'm so glad because partial remission to me, it seems like complete confusion. I mean, that would cause so much confusion in my head. Like, wait, what? You're using this word remission? in a partial response. So I'm glad we don't use that anymore because I think that would really throw people off.
Well, especially when people are thinking of remission equals cure. Like, what's a partial
Yes.
cure? What does that mean?
Yeah. Yeah.
You
Yeah.
know, it's like, well, I want the part that's not cured to be cured, please. Um,
Right.
yeah, and then beyond that, we get so if something doesn't shrink by a third, we have this range that we call stable.
Hmm.
And this can actually, I mean, this probably is some of the most confusing part because for the oncologist, we are saying stable disease, but you may see changes. So what
Hmm.
we classify as stable disease is something that didn't shrink by more than a third, but it didn't grow by more than 20%. So there's this range of like a little bit of fluctuation within this range is overall stable. So you may see on your scan, my tumor was 2 centimeters, now it's 2.2. You're like,
Hmm.
ooh, that grew. And we're going to say, that's stable. And you may say, well, 2 does not equal 2.2. So,
Yeah.
like, please explain. But there is fluctuation. There's fluctuation from scan to scan. Things can things can change, and overall, kind of hover at a particular area. There's measuring differences from scan to scan. Just the way you were angled. Because keep in mind, these are three-dimensional tumors that
Hmm.
we're measuring in 2 dimensions.
Right.
So, maybe there was a little nodule to the end of it that wasn't caught before, but now you're rotated. So it may look like it grew a little bit, or it may look like it shrunk a little bit. And the reality is you're just catching it at a slightly different angle. So we
And I
give some,
and I think we brought this up in an episode before, but I stay so still in that CT scan and try not to move like any little inkling because I'm like, okay, they could read my scan differently, and I don't want that 20% increase.
yeah, yeah, it's like, it's like going to the eye doctor and you're
Yeah.
like, I want to do everything very, very right, or else you're going to have the Coke bottle glasses. And here the stakes are pretty high. You don't
Yes.
want to
Yes.
uh, have a bunch of your tumors look a little bit bigger because you are rotated.
Yeah.
So I think that's
But
important.
I think it's really important for you to say that a 20% increase is still stable because I had never heard that before. And if I had seen 0.2 centimeter increase in something, I would automatically default to that being growth and it being the end of the world and I was progressing. And while it, correct me if I'm wrong, it can sometimes mean the signs of something to come, but not necessarily like at all. And so I think that's a very good reminder for the audience to remember when they see a little deviation like
Mhm.
that. It's not necessarily the end of the world.
Yeah, and I'll say there's some art here. If you
Yeah.
see slow progression in multiple areas, or I'll say slow growth, because it might not meet the definition of progression. If you
Yeah.
see 10% increase across a lot of stuff, or if it's large and you get a 10% increase and it's near something important, the oncology team may act on that. Um,
Yeah.
but by our definitions, we usually want something to be a little more clear if we're going to
Hmm.
make changes in systemic treatment. Because, the paradigm for the most part is you really want to stay on something for as long as you can
Yeah.
before switching. So
Hmm.
a little bit of growth in one little area it's not even 20%, it's just a small change. A lot of times we're going to ride that out. Um, and even if something does meet the definition of growth, you may get situations where it makes more sense to stay on it for a little bit longer.
Hmm.
Um, but that's no longer in the realm of remission. We don't have anti-remission. So yeah, I think that those are a little more clear and
Yeah.
less ambiguity. In the stage 4 setting, we don't really use the term remission anymore. And we favor these words: complete response, partial response, stable disease, growth. And then if you have a complete response everywhere, we'll use the term no evidence of disease. And this is the term NED, NED that people are using in, a lot of the different forums. And there's no reason to not celebrate that. Like, that is a good thing. Less cancer is always better than more cancer. but it doesn't necessarily mean that it's gone forever. And this is a situation where patients will ask me, am I cured? And if here we get kind of into probabilities, So if someone's stage 4 in lung cancer, at least, if they get down to NED, no evidence of tumor, they had a complete response everywhere, they're probably not cured. And we only know this because we've followed it out. There are other diseases where that's not the case, where someone who has stage 4 disease, or disease, I'll say, that's spread everywhere, they get treatment, it's really effective treatment, and they probably are cured. For many types of testicular cancer, they're really responsive to therapies. They undergo high cure rates, even if it has spread. So the only way you know is by doing the studies and seeing. So it's something to
Yeah.
ask your team about.
I hear a lot too and I actually like this term a lot, where people will say, my cancer is sleeping right now.
Yeah.
And I kind of like that term more than these other scientific
Mhm.
terms because, sleeping could mean you're stable, sleeping could mean you're NED, sleeping could mean, well, I guess partial response or a response doesn't mean it's sleeping because it's actually reacting and shrinking, right? So that's kind of a counterintuitive. But when you're like stable or NED, I've heard people say like, my cancer's just sleeping right now. It's just, and people use that as an explanation to their children a lot too, to kind of explain where they're at in their treatment, which I think is just a helpful layman's term thing to say rather than all these scientific terms.
Yeah, I think that's a good term. And I think it's biologically fairly accurate. When we think about these terms, NED, complete response, what we used to mean saying remission is that everything went down on the scan. We don't see anything. And people stay there for a long time. People can stay in a complete response for years and then it grows back. And that's a confusing thing. Like, what was going on that whole time? So, what does sleeping mean? Most of the therapies we use are effective when, I'll say many of the therapies we use are effective when the cancer cell is dividing. So the cause of death for the cancer cell is something during that process of division that says, hey, this is really messed up and it can't tolerate the thing you're doing to it, the chemotherapy, the other type of therapy. They tend to be active if a cell is trying to divide. But sometimes cells will just stop dividing for a long time. They're there, they're just not doing anything, and that's tough because you're getting the therapies, you're on chemo, you're on whatever, and the and I guess the theory is that if a tumor cell starts dividing, they'll be susceptible to that treatment. That treatment will work on that. But there's a bunch of cells that are not dividing very well. They're not dividing either at all or so slowly that it can tolerate the therapy, and then they develop some sort of resistance to it through that process. So that's kind of the confusing part about the cancer still being there, but why isn't the therapy working? Well, it's probably it's the very fact that they're not dividing that makes them resistant.
Right.
And we struggle with that. In the laboratory, we struggle finding effective therapies that kill things that are not dividing.
Yeah, so this might be going down a rabbit hole, but I have been curious about this, and I'm sure others are too. So, if you start a new treatment and your response is purely stable, like you never get that shrinkage that everyone is looking for, or that NED, which is the goal of everyone to get. Does that mean then that your cells are just not rapidly dividing, so that's why you'll just have a stable response? Or is it far more complicated than that?
No, I think it is. It's complicated and probably not. It could mean that a large grouping of cells are under some stress, And when they're under stress from the therapy you're giving them, like they don't like that, they slow down and to try to cope with that stress, and then they'll eventually grow again. So I think that's very possible. The other possibility is that some are dying and some are growing. So, it's possible that your therapy was really effective against a clone of those cells. And this is something we've learned in a lot of cancers is if you take multiple biopsies of one tumor, they might be slightly different. The different areas, even within a tumor, can have evolved, so to speak, slightly differently. So you might have a heterogeneous response even within a given area. But I think more likely it's the fact that those cells are, the tumor cells are under a stress. So they're kind of hunkering down, so to speak. And when I see that situation, if things are just stable, most of the time they're going to get out of that kind of quickly. Not always, but if they don't shrink at all, um, then I think the likelihood of it growing fairly soon is higher than if it shrunk all the way.
Gotcha.
Yeah, it's still a good thing. Like there's no situation in which tumor not growing is worse than tumor growing. Like that's
Yep.
still a win. That's still an effective therapy, but it's not as promising, I would say, as
Yeah.
if it shrunk down all the way.
And, to people listening to this and maybe freaking out by what you just said, I do know people that have had a stable response and they have been stable for years.
Yeah.
So it totally depends, I think. But that's super interesting to know because I've always been curious about that rapidly dividing cell piece because it's like, okay, well, if your cells aren't rapidly dividing, surely that's better than not. So if you're not having rapidly dividing cells at stable, but you are at shrinkage, and that's how it's shrinking, that seems to me, in my layman term head, that stable is better because you don't have rapidly dividing cells. But so you've kind of debunked that and super helpful to understand a little bit better on the layman terms level.
Yeah, and I mean, I think your point is well received. This is all probabilities.
Yeah.
So
Yeah.
and this is the big unfair thing. One of the many unfair things about cancer is that there's no rule that fits everyone.
Right.
People.
Which is so
Yeah,
annoying.
I mean, we're in the lung cancer sphere,
Yeah.
and you didn't smoke and you got lung cancer, and plenty of people that smoked like it cures cancer and don't.
Yeah.
And along those same lines, someone can be on a therapy and the tumor doesn't change, but someone who had a complete response, they have no evidence of disease, they think they're cured, and then 3 months later that can progress. There's not
Yes.
a whole lot of fairness here, but there are
Nope.
trends. Um,
Yeah.
but
Yeah.
yeah, it's important to not take any of those trends and say for sure that's going to happen to you.
Right.
And the same, I mean, this is also a tangent, but the same goes when I hear this all the time. Someone says that my doctor gave me X number of months to live, and now I'm still here.
Yep.
And I was like, no one has that crystal ball, that knows
No.
exactly how you're going to do. Um, and that's tough because we want to give some reasonable expectations. But
Mm-hmm.
in generally speaking, when someone hears that, that's the average, so to speak, of
Yeah.
people. But people live well longer than the average, and some people will live shorter than the average. And you just gotta go through it.
Absolutely.
So, Samantha, when you first heard the word remission, did you have this sense of the small cells that are sleeping, or did you know that yet when you were piecing those things together?
I know far more now than I than I ever have. So remission to me literally was you are cured. I knew something about people being stage 1, stage 3, to stage 3, that they would get scans for 5 years.
Mhm.
I knew about that you would get scans for 5 years, and once you hit that 5-year mark and you were still clear, that really counted as like full remission. In that 5 year mark, it was like something could still come back. We're unsure. Do do do. But 5 years was like yes, because I remember people like in the media or famous people, they'd be like, "It's hit 5 years. I'm in remission." Like,
Hmm.
so it's always been that 5 year mark for me that was that understanding. Whether that's right or wrong, I don't know.
Yeah, I think the answer to that is it depends. And you raise a good
Yeah.
point. Like the terminology, is it the same? Is it different in different stages? Most of the time here, we've been talking about stage 4, which
Yeah.
means the cancer has spread everywhere. And we follow it pretty regularly with scans. In the solid tumor world, to say not leukemia, or yeah, mostly leukemia, the paradigm is we are on a therapy most of the time indefinitely,
Mm-hmm.
and forever, and you get scans regularly every 3 months, 4 months. Sometimes we'll space it out
6 weeks.
6 weeks, and sometimes we'll go sooner. But those are the general rule, or
Yeah.
generally how it goes. But that's because that is in a situation where we think the likelihood of cure is low. I'm not saying zero. There are metastatic situations that can be cured, but once you get into stage 1, meaning the tumor is just in one location usually, stage 2, maybe it's spread to some lymph nodes, stage 3, maybe bigger, spread to a little bit more lymph nodes, but it hasn't quite gotten everywhere. Those are usually what we mean by the staging conventions, although it's different for different tumor types. People listening are like, there's caveats to everything. But I don't like to use the term remission in any of them, but I do think the likelihood of cure is higher in the early ones. And when I say cure, I mean there is no tumor alive in your body. The tumor that we
Yep.
just diagnosed is gone. There is not a single
Yep.
cell, or if there is, you will never see it. It will never grow. Um, and we get that with stage 1s when someone can get something cut out, but we'll tell people and they'll have this sense like, oh, I'm cured. You cut it out, but then you'll notice they still get scans. And that's because we only know what we saw. We saw there was a tumor there. We can't know if there's a small bit of tumor elsewhere that we didn't see. When they do those surgeries, they'll take out lymph nodes, they'll see did it spread to lymph nodes, but there's always a chance you missed something. There's always a chance that it spread somewhere else. Maybe the likelihood is low if it's a lower stage, but there's always that chance. So I don't like using the what I think is kind of confusing terminology with remission, because it doesn't really get into the probabilistic stuff that I will get
Yeah.
into with patients.
You'll hear doctors say a lot, we're going for a cure.
Hmm.
I think you hear that quite often. I've obviously never heard that, but you have doctors saying, like, we're going to go for a cure for you. Um, I hear that more than anything else in the stage 1 to 3.
Yeah. And I think so. The things that can lead to cure are, for the most part, surgery and radiation.
Mm-hmm.
So when we say that, what we're meaning is we have surgeries that can cut out all of the tumor that we know about, or we have radiation plans that can burn all of the tumor that
Mm-hmm.
we can see. And we think with some high likelihood it hasn't left there.
Mm-hmm.
We think it really is in all those places we can see and nowhere else. Now, we'll say we'll go for cure in those situations, even if the probability of cure is low, but we should be transparent about that. We're very, very aggressive if there's a reasonable chance of curing someone, meaning like over 5, 10%. We're willing to tolerate, or we're willing to recommend things to have the patient tolerate a pretty large degree of discomfort if it means ridding them of cancer. So same in lung cancer, stage 3 means there's a large tumor somewhere, fairly large usually, or it's spread to the kind of more distant lymph nodes in the chest. And we'll give aggressive radiation plans. We'll give chemo with it, and they'll be maybe on a therapy for a year or so after. These are evolving paradigms, but that's generally how it works. We're trying to get rid of everything. And that's a situation where you'll hear we're going for cure. Um, but it doesn't necessarily mean the cure rate's 100%.
Yeah.
It depends tumor to tumor, but you'll hear that from stage 1 to stage 3, and the likelihood of cure is much higher in stage 1 than stage 3 for
Right.
lung.
Yeah, I hear a lot of sad stories where people are diagnosed at stage 3 and then it jumps to 4, sometimes within a matter of months, unfortunately, and it's just heartbreaking.
Yeah, I think when we do this staging, it's important to remember, realize, I suppose, although hard to kind of cope with, is that we can only see what we can see, and we're limited by the technology. Our scans
Yeah.
are good, but they're only so good.
Yep.
Something has to be visible on the scan for you to see it, and by that time, millions of tumor cells are there. Like, that's a
Yeah.
lot.
Yep.
And there is a belief in the field that if you get down to just a few tumor cells, the immune system can actually keep it at bay fairly well. We're getting a better understanding that the immune system is important in keeping the low amount of tumor cells sleeping, so to speak. But if you can see it on the scan, it's too big. And so that's a challenge. Is you want to give people hope. From Certainly from my role, I try to give people as much hope as we can. But you have to be realistic and say, you may be getting a curative intent treatment, but you've got to do the follow-up scans. You've got to do all these things, and it's tough because radiation to some of these areas is pretty aggressive, and there can be there can be a lot of side effects, and you want that to be worth it.
So this might be going down another rabbit hole, but I think related to this is you said about the immune system and how it can go after some of the cancer cells. So I see a lot on social media, like everyone has cancer cells in their body and the immune system just goes after them. And that's why you don't end up getting cancer. But when you are like a certain stage of cancer, and you actually do have cancer, stage 1 through 4, is the immune system still doing things to attack and put at bay cancer cells, even though you actually have cancer?
That's a solid question. So I think the first thing you asked is when tumor cells are starting, I'll say, and what I mean by that is a mutation has occurred, something happened to a normal cell that was doing everything right, and it turned it cancerous. Now, a lot of things have to happen for something to go from, I can divide an extra time or two, to truly uncontrollable cell division. But sometimes it's only one or two things, but a lot of times it's many things. And the immune system can find and clear those. We know that to be true.
Mm-hmm.
Your cells in your body are always uh, taking little samples of all the proteins they make, and they're presenting them to the immune system specifically. And they're
Mm-hmm.
saying, hey, I found this, like I made this. Is this normal? Is this not normal? And the immune system will go and be like, oh no, that's not something from us, and it'll remove it. So it'll kill that cell. And that's a really effective, we think that's a very effective strategy that the body has to remove the small things that would become cancers.
Mm-hmm.
um, they do still interact with tumors once they're larger.
Mm-hmm.
And we had an episode with Natalie Vokes, another physician at MD Anderson, who does a lot of work in immunotherapy, because that's the role of immunotherapy. That's a whole
Right.
class of therapy that helps the immune system attack the tumor. But tumors, in order to have started and grown and then become the cancers that we see, had to develop some way around that. Like
Mm-hmm.
they evaded that mechanism that the body has to fight cancer. So they've already done that. And
Yeah.
one of the mechanisms that they used is by putting out a lot of signals. Like, these are receptors on the cell, and the cell is a sphere, and it'll stick out this this protein, and it tells the immune system to back off. And we can block that signal. So the immune system doesn't see the back off signal. And then it's like, okay, you were messed up. I'm going to kill you now. And
So
it's
rude.
pretty rude. Yeah. It's sneaky. You've used the word sneaky a lot. They're very sneaky.
Yeah.
Um,
Yeah.
and that works in some cancers. It doesn't work in all cancers,
Yeah.
unfortunately. But you're right. I mean, at those small levels of disease, when tumors are starting, and even once they've shrunken down a lot, I think there's more interaction between the immune system and those tumor cells.
Mm.
Like if you think a big hunk of tumor, which is what we see when we have stable disease or partial response, there's still a big hunk of tumor there, biologically considered. If you can see it, it's big in the body. It's big
Yeah.
as terms of the immune system goes. And it's hard for the immune cells to interact with every tumor. There's more opportunity for resistance and things. But when it's smaller, I think there's more opportunity for the immune system to do its job.
Interesting.
So
I learned so much from you.
yeah, I learned a lot from you. I mean, we've talked about kind of getting to the perceptions and everything. You've had varying degrees of responses from
Mhm.
areas of stable disease to most of your tumors have shrunken down. And when I think emotionally that's consistent with what other people would have called partial remission, or it's not growing, so it's in remission. Like you're experiencing what those terms I think really meant, um, which was back in the day, we didn't have a lot of therapies that worked at all. So
Mhm.
if something was working, you were in remission. This is how I think we mostly used that.
Which is wild to me. I am
Yeah.
never going to use that word for me ever.
Yeah, and I don't think we should.
It's just
You know, but I think it gets to the heart of we still monitor all this stuff.
yeah,
So I'm curious, just the anxiety that goes around monitoring tumor growth, like, because everyone back in the day, everything was, am I in remission? Am I out of remission? But you're still
interesting.
doing that. Like you still have that
Yeah.
same process now.
Yeah.
And I mean, you've talked to me in other situations where we interpret scan results, because we have a lot of information now that we didn't used to have, and a lot of
Yeah.
granularity now.
Yeah.
Um, yeah, I mean, how do you cope with tracking tumor progression? What we used to say tracking remission, but we'll say tracking the tumor dynamics.
So I post about this a lot on my social medias of me breaking down and crying around scans. Because it's real, it's raw, and it's what happens to a lot of people. Especially as I have scans every 6 weeks, which is a lot emotionally. Like I don't even, I'm coming down from all this anxiety of a scan, and then, by the time I come down, I've got another 3 weeks, and then I've got another scan again. So the emotional roller coaster of it is a lot. And I think people that go through this every day, you're thinking, are my tumors, what are my tumors doing today? I mean, I literally think about that in my head. Like, are they suddenly turning on me? Are they still shrinking? And I'm kind of in this positive area, or are things going bad again? And it's just an absolute roller coaster of emotions. And any little pain or niggle or anything I get in my body, I'm like, oh, is that something? And I know everyone goes through that too, who has cancer, regardless of the stage. And I'm sure if you're stage 1 through 3 and you've been told you're in remission, but you have a new pain, or you have a new ache, or your back suddenly hurts, or your breathing's a little bit off, like you always going to default to, is it the cancer coming back? And I think that's very natural, very normal. And so that's why I get angry a little bit about this word remission, because I think it can, to some people, they go through what I just explained. And then I think other people have this false sense of security and misunderstanding almost. So I think there's two extremes, and I don't think there's anyone in the middle. It's either like, I'm in remission, I'm cancer free, I never have to worry again, and they don't. or it literally controls your life and every emotion that you go through. And I wish there was a happy medium, but it seems to be that people sway one way or the other.
Yeah, and I think the process you're describing, where any new thing that you're not used to feeling is that cancer, through the lens of an oncologist, I share that. So I want people to think there's a chance that could be cancer related. We should bring it up because I do think there's a lot of people who feel something, minimize it. I mean, you don't want to go do more scans. You don't want to do more testing. You certainly don't want it to be what that fear is. But then on the flip side of that, I've seen many people who were early stage didn't undergo their follow-up scans because they're like, well, what's the chance I get a new cancer? And it's like, well, really, we're scanning for areas that we didn't know about before that are
Yeah.
just growing, or your tumor progressed quickly, and they don't do it. And it does come back. Like it does progress. Um,
Yeah.
so I think,
And yeah. Well, I was going to say likely a podcast for another day, but I've seen a lot recently where individuals I've met have one cancer, they go into remission, and they unfortunately get another cancer, whether that be because their cells weren't checks and balancing anymore again, or they had radiation that caused maybe another cancer. But maybe a topic for another day for a podcast. But it's the remission celebration,
mhm.
new aches and pains, maybe, and then actually be a completely different cancer to the one you even had before.
Yeah, and a lot of as you mentioned, a lot of the therapies for one cancer can put people at risk for other cancers.
Right, right.
And in healthcare in general, one of the highest risk things for something happening is that it happened before. Like people who
Hmm.
had strokes are at more risk for other strokes, heart attacks, more risk for other heart attacks, and cancer's no different. If
Yeah.
you had a history of cancer, something about the cells are probably at higher risk for developing other cancers. So we do want to keep monitoring. Um, but it's tough, and as you mentioned, we've had this talk before, the the cancer-free bell, the remission bell,
Yeah.
um, everyone says I'm done. And I find that pretty heartbreaking because I've seen enough people who ring that bell and then a year later,
Hmm.
they have the same thing return. And it was just because of a misunderstanding of what was going on in the body.
Yeah. Yeah, and I think, like I said, you have those two extremes of people, and some people will latch onto their in remission and think they are fully cured. Even, we were talking about this before we started the podcast, that I see stage 4 patients on social media saying that they're cured because someone told them that they're in remission, and my heart breaks for them because I don't know if they're doing it to just unfortunately get more social media likes and get more attention around their social media page because they did alternate therapies or what have you, or it's merely a complete misunderstanding because they've heard certain words from their doctors and they're taking it and rolling with it. And yeah, it's sad. It's sad to see. While I always want people to be positive and happy and upbeat as much as possible, there's a reality to it as well that I think needs to sink in with people. Definitely.
Well, and I think, to be frank, some of the blame of that misunderstanding lies with healthcare. I
Yeah.
think we don't always explain what's going on well enough. And, I'll say as a provider, we're human too. We
Yeah.
want the best for a patient. We want the person that's coming to us for help to feel like we're helping them. And there's no way, like I said before, where you had a bunch of tumors and now they're totally gone. Like we do want to celebrate that. And I think we, as providers, will maybe sometimes be a little heavy handed with the implication, like, I don't see any cancer. And it's very easy for the person who hears that to interpret it as there is no cancer. And it's very easy for us to not deflate that moment So I don't know. I mean, have you heard situations where people hear that situation, or like, their oncologist says you're cancer free and stage 4,
Yes,
you know,
I've heard it quite a lot, even in lung cancer too. And while I'm extremely happy for those people, it's like the negative Nancy side of me is like, but when is it going to come back? And it's just, yeah, but like you said, you need to celebrate it. You need to latch on to that win, and be happy about it. But just be aware that you just don't know what's going to happen in the future. But I've definitely seen it. I've seen it more outside of lung, though, in social media stuff, especially, where people will say that they are in remission and cured. And like I said, they'll post all the alternative therapies that they did and put it down to that is what cured them. When in actual fact, you don't know if in 3 months it might actually be back because you're stage 4, and then you'll actually be able to see it on scans. But they say that they are cured, and because they ate some leaves or something, and it's again, are they in a delusional state because they latched onto something their doctor said, or are they doing it because they're trying to get likes? And I don't know.
and it's tough because nowadays, what a lot of people who are posting are not mentioning is the other stuff they're on, like the
Yes.
cancer directed therapies that we prescribe.
Yes, that thing.
Yeah, they don't tend to mention that quite as much. And I think you're right. We do have therapies now that can bring something down to where you can't see it on a scan anymore.
Yeah.
Like that's happening with increasing frequency. And I think when someone tries an alternative therapy, uh, and is on a really effective medicine, they'll have the perception of back in the day when we just had chemo, which didn't
Mm-hmm.
always work very well. So
Mm-hmm.
you didn't get as many complete responses. We had tumor, we don't see it anymore. So now when you see that, there are a couple of things are going on. One is, I hear complete response, no evidence of disease, cancer free, pretty quick to latch onto that.
Yeah.
But since I didn't used to hear that, the thing that seems different to me is, this particular alternative therapy that I've tried, it's probably that. So
Mm-hmm.
I can understand how someone does conclude that, but I definitely want to, caution folks listening that a lot of the stuff you're seeing in the alternative therapy social media world is partial pictures, or you're not going to hear a whole lot of follow-ups that say, oh, wait a minute, actually, I progressed, and let me post about it. Turns out that therapy I
Right.
tried wasn't effective. Please stop buying it.
Yeah.
Like you're not going to see a lot of that.
Nope, you're not. You're not.
And I'm cynical. I think, we're in a privileged position here where we don't generate any revenue from this podcast. Um, so we don't have anything really to gain other than just trying to educate folks. Uh, but I am cynical. I think a lot of people who are posting on social media to try to get people into this complete remission, complete response, I think it's predatory.
Yeah, it absolutely is.
Yeah.
Because you're just grasping at straws, trying to find that one thing that might tip you over to go into remission, so to speak. And yeah, I get bombarded with it every day, and it's like you're weighing up the decision of, do I try this? Should I? Because everyone wants to get into that remission state. No evidence of disease on a scan. I mean, especially at stage 4, to have no evidence of disease. I mean, that's just something that everyone strives for. And so when you see these things, it's like, could this tip me over? Could this be the winning thing? And in most cases, it's not.
Well, and I mean, correct me if I'm wrong. Maybe you can alleviate some of my cynicism. But most of the time, when these things are being pitched, they're not free. Am I correct in that?
Correct. Yeah.
Like, what are some examples? I'm just curious. I don't follow those things.
I mean, a lot of people on social media will say, like, sign up for my program and I'll tell you the 5 steps I did to cure my cancer. That kind of thing. And then a lot of people will say, it'll be like a hook where they'll be like, I took this product. They won't say what the product is, but they'll say that I took this product and it cured my cancer and I'm in remission. And then they'll say, comment whatever to get told what I took. And so that will generate likes and comments on their Instagram, which in turn turns into revenue for them on Instagram. Because they're not just giving away what they're taking. They're making you take that extra step so that they get revenue and likes. And I just think it's disgusting. It really, really irritates me.
Yeah. I mean, I struggle even with our podcast initiative because we're on all the social media platforms and you do see all the people doing the gimmicks.
Yep.
And I get it. I was never in social media like really at all before doing this. So I didn't understand the dopamine you get when a lot of people are watching your stuff. And I
Yep.
get it a little better now. Like I understand the psychology, but
Yeah.
I don't really know how you sleep at night. Like I think you have to believe what you're saying. I think there's
Yeah.
no other way.
Yep.
Or you're like truly the worst. And I just believe a little bit more strongly in humanity than that would justify. Um, but yeah, I think when people have so much to gain from manipulating a vulnerable group, like it's really important to approach that stuff with a lot of caution. And
Yeah.
I mean, the same is true in the medical field too. Like we have studies we can show, and that's helpful. But you need to do what's right for you and figure out the best. You know what you believe to be true based on what your oncology team is telling you. But we have the benefit of evidence. That's not
Yeah.
anecdotal. Meaning, I had a cousin who did X,
Yeah.
and
Yep. No, absolutely. And now I'm on targeted treatment. I'm responding the best I ever have. I could be that person very much so who's like all of a sudden saying like my cancer's so much better and it's dramatically doing, shrinking and doing amazing things. And I took X and comment here and I'll tell you what it is. And it's like, well, in actual fact, I'm just on the first ever targeted therapy that I've ever been on that happens to work really well with my mutation. And that's why I'm responding really well. But I could totally play it as something else. And I think that's what a lot of people are doing. And it's unfortunate.
well, and
So I would just caution the audience, like just take all this stuff with a grain of salt. Yeah.
yeah, and again, I want to reiterate, I do think that the people who are posting this are probably believing it,
Yeah, I think so
but
too.
they're always leaving out the other half or
Yeah.
they're commonly leaving out the other half. Um, but I think speaking around this world of remission, that I think now that term is probably going to be more associated with the scams and gimmicks
Yeah,
because people hear
I
that
think
and
so
they think
too.
cure. But
Yeah.
you're not going to hear you might hear some oncology groups using the term remission, but we're probably not going to say do this and you will get remission.
Yep.
Generally speaking, for all the stuff that I talk about, you hear all my caveats, you hear the percentages of this is more likely, that's more likely. It's like when people are wishy-washy like that, it usually means that they've seen enough to know like reality. If something sounds too good to be true, it is too good to be true.
Yep.
And I would say that there are differences. Like as we progress with cancer treatments and get better, like the medicine you're on, a targeted therapy type medicine, those are working really well for a lot of people and for many a long time.
Yep.
So, but still no one's going to say everyone.
Yeah.
Yeah. Well, what are some last things before we wrap up here? Any things you would want to, I guess, tell to a patient who is told they're in remission or they're hearing about remission socially?
Yeah, I would just say just be cautious. Be cautious. Um, Listen to your body. Be aware of it. Bring up things that are different with your doctor, and new aches and pains, things like that. Just be very conscious of if you're told in remission, I don't know, for me personally, don't just go off and live your life and think everything's going to be roses for the rest of your life. Be aware, be cognizant of changes or things, because you just never know. It's a word that is thrown out a lot, puts you in this false sense of security, I think, a lot of times. And so just being very wary, but not overly wary, and live your life, of course, and be happy and be positive, but just have that little guard up, I think, in the back of your head to be wary of any changes.
Yeah, I couldn't agree more. I think it's so important to take your wins
Yep.
and really like do celebrate your wins.
Yep.
There's a lot of resistance because you may know it might progress again, and there's always yes, but take your wins and but still be aware that things may change. And I think navigating that balance might require seeing a therapist, like talking to someone who helps you navigate the emotional challenge that is, how do you be happy in the setting of something that may ultimately end one's life? That's really hard. And
Yep.
I think a lot of people don't do it alone, but celebrate where you can without
Absolutely.
putting your head in the sand.
You summarized that so much better than I did, because I have chemo brain. My summarization was not on par with normal. So I appreciate the more accurate summary you just did.
I thought you did well. And I think this is a testament to anyone who is worried about, having chemotherapy, having chemo brain. I can't tell at all. Like, to me,
Okay, that's good.
I don't know if that's
good.
I don't know how you're going to interpret that, but you sounded articulate now.
That's true.
It's like, usually I don't understand anything you're saying. This was no different. No, I think you did great. I think you did great.
Thank you. I appreciate that.
All right. Well, that's time today. Thanks everyone for listening. I hope you enjoyed it. Let us know what other things you would like us to cover. Like, subscribe, and visit crackingcancer.org for more information. All right. Bye, everyone.
Thanks, everyone.
Thank you for joining us on this episode of Cracking Cancer. If you found this helpful, please like, subscribe, leave us a review, and visit crackingcancer.org for more information. Every dollar we earn goes directly to furthering the podcast and supporting vital cancer research. Because together, we can crack cancer.